if you can just explain us what really breakthrough infections are, because there's so much in mind that do we need to vaccinate it? People who are vaccinated are getting COVID-19. So just explain us what breakthrough infections really are.
Thank you very much. I think that's a very important and a very good question to start off with. When we look at the word breakthrough, it means that there was something stopping the infection from happening. And that stopping is the antibodies which are there in the patient. Now, where does these antibodies come from? We know for sure that when we vaccinate a person and we fully vaccinate a person, according to the schedule of whatever vaccine they have taken. I'm saying this because now we've got schedules of 1 dose vaccine, we've got schedules of 2 doses, and now we've got a Zydus COVID coming in with 3 doses as well. So once you've completed your schedule for the vaccination and 15 days have gone beyond that, then you have essentially got a complete immune status for that person. And if a person after that has an infection, that's what's called as a breakthrough infection. So that's what a breakthrough infection is.
So, okay, so you've explained that really well. So again, why is vaccination important? How much does it really protect us?
Excellent question again. I think let's understand the purpose of vaccination. So the purpose of vaccination is to prevent deaths. That's the first purpose of vaccination. You look at any vaccination program in the world, which was started right from the beginning of the 19th century. The first purpose was, can we prevent death? The second purpose of that vaccine is to actually try and see if we can decrease the infections. And then the third and the important one comes that when you've reached to a critical point of actually almost everyone being vaccinated, that's when we talk about eradication from the disease. So smallpox, for example, polio, for example, after so many years of vaccination, we had eradication from the disease. So the COVID-19 vaccines right now, whichever are approved, there are 6 of them approved now in India, whichever are approved have got a very, very good protection from the death, very, very good protection from severe infection, and a reasonable protection from moderate infection. That does mean that you would have a mild infection at times, but majority of the people may still not have a mild infection. They would be having a good protection against the disease as well. But it can't be said for all the people.
So it's better to, obviously it's definitely safer. It reduces the effect a lot. Yeah.
100% safer. It helps you from preventing death, and it helps you in basically getting into intensive care unit or on oxygen bed.
Okay, great. So in fact, we've started getting questions. The first question, which I just asked you, is actually why are COVID vaccinated people catching COVID at a surprisingly high rate?
Okay, so I think that needs to be a little bit clarified that fortunately, the COVID vaccinated people are not catching infection at a surprisingly high rate. If you look at the total number of people who are vaccinated, vis-a-vis the people who have got the infection in the vaccinated group, you will see that that percentage is still much, much smaller to the group which was unvaccinated and who got an infection. So vaccinated group are definitely catching infection, but not at an alarmingly high rate that we should be worried about. But the good thing is that when you compare these two groups, you see that the group which was vaccinated is not requiring hospital on majority of these cases. They are at home. And the live example of this is United Kingdom. You see there are almost 25 to 40,000 cases coming positive in UK every single day, but not once have we heard of their hospital systems getting stretched. So most of the people are being cared for at home like an influenza or a flu-like illness. Whereas US, some of the states have really been stretched where the vaccination population was very small. The states which had a good vaccinated population, I think they are still comfortable.
Okay, so vaccination is really important, and I think there are a lot of, awareness needs to be there that in some way, you can get infected, but it is protecting you in a lot of ways.